Okay, I was waiting for the magic 11:03, and we have a number of people already on the line. So I will start the meeting, and a very warm welcome to you all for this meeting of members of the Faculty of Public Health from the Middle East, Pakistan, and India. Just like to do a few introductions, and for those of you who are not already a member of one of the SIGs or other, if you could just maybe put your name and where you are from into the chat so that we know who's here. We don't have time to introduce everybody individually, but I would like to do a couple of introductions. And before introductions, just to let you know, this session is being recorded, and we hope that that is okay with everyone. If there's any issues, please let us know, or you're welcome to leave. I'd like to introduce Susanna Matthew and Soking Ong. If you could just raise your hands or wave so that we know you are there. Susanna and Soking, who are the leads for overseas members. So any issues of overseas members, they coordinate for us. And then on the meeting today, we're going to have Hema Shukla and Giri Shankar, who are the co-leads for the India SIG. So Hema and Giri. I saw Giri on the line.
Yes, Chair. Good morning, everybody.
You're there. Good.
I'm here. Yes.
And I'm sure Hema will be joining. And from the Pakistan SIG, we've got Samia Latif and Mohammed Ali, and I've seen Samia. And Mohammed, are you here yet?
Hi.
Mohammed,
Yes,
good,
hi.
great.
Okay.
So, Mohammed Samia. And for the Yemen SIG, we have Anne Hoskins. Morning, Anne. And we have a potential Gulf SIG, and that is Omar Kaya. Omar?
Hello, hi, how are you?
Good. So I think with those short introductions, just to show who is going to be speaking today, we will start the presentation. We have a number of presentations today, really to look at the work of the SIGs and the overall work of the Global Health Committee. You can see the agenda before you that you've already received. So we'll move on. Thank you, Caroline. And Caroline, sorry, I didn't introduce you. Caroline Wren, who is the power behind all of this, because she is the fantastic organizer and is making sure that everybody gets online and will give us a good summary afterwards. So just for those of you who are not really aware of the Global Health Committee of the faculty, just to give you a few key pointers, that we have a number of special interest groups, and the special interest groups fall into two categories. They fall into the geographical SIGs, and those are for individual countries such as India, Pakistan, Sudan, Yemen, and for regions such as the African region. We have also one for the European region, and we're looking at what the potential for having other regional SIGs is. We also have special interest groups for subject matters such as non-communicable diseases in developing countries, for violence and injury prevention, and for disasters and humanitarian action. Those are all fall in with the Global Health Committee. We do have within the faculty many other special interest groups, including climate change, and I know that a number of people are interested in that, particularly in countries where it's already making a huge difference to both the health and the environment within those countries. In fact, most countries are affected, but some are affected more than others. So what are the key priorities of our Global Health Committee over the year? The priorities that we pulled together from the different SIGs and looking at developing public health capacity globally and providing FPH expertise to the WHO roadmap on national workforce capacity and essential public health functions. And particularly looking at the way that the training is done in the UK with a specialty training and key skills that are obtained over a number of years, as opposed to many countries where there is only a master's in public health, and then this is not necessarily followed up by supervision and specialty training. We advocate for improved public health internationally. We strengthen partners with key public health bodies. Part of that is developing synergies across the different special interest groups and communicating our work through the faculty website. We are aiming this year to increase engagement with overseas members, and this is one of the meetings where we will look at how we can increase our engagement, particularly with the Middle East and the Gulf region, and then also support registrar-led work on global health placements. We do have a very enthusiastic registrar body. And with the very enthusiastic registrar body, they are able to give some time to specific projects, and therefore some of them give time to work on the different SIGs. And throughout this, we ensure racial equity embedded in all our work and all our work, whether it is overall for the Global Health Committee or the SIGs itself. So these are our key priorities for the year. And with that, what I would like to do is to move on to the presentations from the different SIGs. And then we will have, following that, we will have an open discussion to see how we should move forward with the Gulf region, Middle East region. So first of all, we have Anne Hoskins, who's going to talk about the Yemen SIG, and she has been chair for a number of years. So Anne, over to you.
Thank you, and welcome to everybody. And just as a bit of context, I worked in Yemen for 10 years early in my career. So the Yemen SIG, it started in 2016, and actually it started around at that time there was cholera outbreak. And we started with a project on seeing if we could use WhatsApp to get preventative messages out into remote places. That's another story which I won't dwell on, but just to say we learned a lot, but there were some real feasibility issues that we couldn't overcome. So our present work plan, it focuses on advocacy, increasing public health skills and research capacity, and knowledge sharing between those with an interest in public health in Yemen. And I think membership has varied over the years. So we're always been sort of small and perfectly formed. And I think that's because it's been difficult, certainly within the faculty, to get people that have had interest in Yemen, it being such a sort of small country in the Middle East. But we also have been able to get some public health professionals who are actually in the region. So that's useful. So we've had recently we've been working with the International Association of Public Health, looking at potential opportunities for joint working on collaborating on public health courses, especially looking at translating them into Arabic. Our main piece of work recently in the last few years has been a mentoring program working with as Yemen Public Health Praxis, and that's in partnership with Health Professions for Yemen UK, the Yemen SIG and People's Practice, which is a charity organisation looking at giving public health mentoring to different health professionals. And we've worked hard in that programme, and it continues on. And we also undertook a dental public health literature review in Yemen, because once we opened the mentoring programme, we had an awful lot of dental professionals interested in getting involved. So next one. So just looking at some of the advocacy, we are working in partnership with the National Reconciliation Movement, multidisciplinary network of Yemenis diasporas working for peace. We have a bulletin which updates the situation in Yemen and the SIG's work programme. And in past years, we've done public health peace vigils in Liverpool. I'm based in Liverpool, to keep Yemen on the agenda. We always thought that Yemen was a forgotten war, but unfortunately, in many ways, the Middle East is a very hot place now, and Yemen is again on the news, unfortunately, for reasons that aren't good for the population of Yemen. So that's a very quick overview of some of our work programme, and I think it's been really helpful just to keep us moving over those many years. So thank you all very much.
Thank you very much, Anne, and let's move on to the next presentation. Caroline, do we have, are we got Pakistan next or India? Not sure if you've got the presentation there.
I think should we go with Pakistan and then India.
Okay, great.
Thank you.
So Samia?
Oh, Caroline, I thought we had sent some slides, but if not, that's fine. Do you have them, Caroline?
I think, yeah, was Mohammed in a position to
Yeah.
screen share?
Do you want me to share my screen, and then
Yeah.
Sammy, you can let me know
Yeah,
when
that's
to.
fine. It's a very
Should we
short
do that way?
presentation.
Is that okay,
fine.
Caroline?
Yeah,
Okay, thanks, Mohammed.
That's great, thank you.
So while Mohammed's trying to do that, hello everyone. Good to see so many of you here and a lot of familiar faces and names. Mohammed and myself are the co-chairs of the Pakistan SIG after having taken over from Zafar, who has chaired the Pakistan SIG for many, many years. So thank you, Zafar, for handing us over a legacy. So other than ourselves, we have a steering group with some other key members, but we are looking to expand that. And currently we have 48 registered members, but we do have a lot of, we call them associate members, who are not registered with the faculty, but whom we work with very closely in Pakistan. And a brief whistle-stop to our next slide of the history of the SIG is that we have worked very closely with Pakistan, produced a few reports, in particular with the Health Services Academy in Islamabad, as well as the Khyber Medical University in the KPK region, and a few of us have attended conferences there, presented there. We supported them during the COVID pandemic, have had a few newspaper articles, and a lot of work was done on the recent floods, which has been presented both at the faculty in Pakistan and also published at the BMJ. Next slide, please, which is just a picture really. But one of the things we did when we presented at the Academy in 2017 was we did set up a mentoring program as part of the IHR, International Health Regulation program. I think it was we were one of the earlier SIGs to adopt the mentoring program. There were 4 of us who were trained as mentors, and we mentored mentees in Pakistan. Unfortunately, it was never evaluated. There is one more slide, I think, Mohammed, that you're going to talk to. But we are now working with People's Praxis on a future mentoring program. So over to you, Mohammed.
Thanks, Samia. So I'm Mohammed. I'm one of the co-chairs for this SIG. So we've developed quite a nice work plan, we believe, that's available on the faculty website. Our stakeholders feel like and the people that are involved are quite keen on developing sort of the research aspects of the SIG. So we've got quite a few academics that are involved from the UK perspective and in Pakistan. So just to give you a brief overview of what they look like, we're developing a couple of grant submissions. One in particular is quite interesting around One Health and dengue fever, which we're really trying to push forward. We've got SIG members that are involved with charitable organisations in Pakistan, and that charity in Pakistan, Shanti, are quite keen on sort of broadening their research. So we've got academics like Professor Anjum Memon and myself that are involved with that to try and look at anemia within children in the Karachi region. We've also got quite an exciting antimicrobial resistance project that we're trying to get off the ground as well. So we've had preliminary meetings, and that's going to be a collaboration between the faculty and healthcare providers in Pakistan, as well as academics here in the UK. One of the final things that we're very keen on looking at as well is the health inequalities between the different provinces in Pakistan, and also between the different religious groups as well. In terms of mentoring, Sammy's already mentioned mentoring ourselves, and we're developing sort of a partnership working with the People's Praxis. So we're quite keen on increasing our sort of scope of mentoring from a SIG perspective. So we've got very keen people from Pakistan who are interested in being mentored as well. So we're trying to get that off the ground. Thank you.
Many thanks, both Samir and Mohammed. And as you can already see, there are some veins running through the different SIGs that are, harmonious. We can move on to the India SIG, Hema and Giri. Hema, you're muted.
Hi, everybody. So perhaps, Giri, do you want to say a little bit about the work you've been doing recently in Hyderabad, and then I'll talk about a few other things.
Yeah, yes, of course. Thank you. I just put one slide together. I don't know if this is showing on the screen.
Yes, excellent. Thank you.
It is. Okay, lovely. Thanks. The India SIG has got a slightly different title to the rest of the SIGs. It is India and related countries is the title. So the related countries bit is something that is intentionally kept high level so that it can help bring other countries in the neighborhood of the Indian country together. So we're thinking about Nepal, Bhutan, Sri Lanka, Bangladesh, etc., so that there are common public health problems that can be addressed. The India SIG has been in existence for a number of years, and some quite under the leadership of Sushma Aquila, a number of significant public health impactful projects have been undertaken, and these were largely through funding available from DFID at the time. However, those funding streams have dried up in the recent years, and also with the interruptions from the pandemic, the SIG activity had gone very quiet. So last year, myself and Hema took over as co-chairs of the SIG from Sushma, and we are trying our focus for the next couple of years is to resurrect the SIG and then bring it back into mainstream and collaborate with a lot of partners. So what you can see on the slide here are our top 5 objectives for the next 3 years, which is mainly, as I said, to increase our membership and then to establish a number of partnerships to begin with a handful of national and subnational public health organizations, then to reach out to our colleagues in the FPH membership itself, plus through them to countries in, as I mentioned, in the Indian neighborhood to get more members in, and then a couple of specific activities around workshops and conferences. And as some of you may be aware or may not be aware, there are a lot of SIGs operating under the Global Health Committee and also under the wider Faculty of Public Health. I think there's a great opportunity for us to learn from each other. Just listening to what Sami and Mohammed said earlier, such a lot of good work had already happened in Pakistan. There's so much we can learn from those sort of projects and implement. So that's broadly where we are. In terms of specific activities, through some contacts, I was able to join the National Conference of the Indian Association of Preventive and Social Medicine, which is the equivalent of Faculty of Public Health, which has got in excess of 15,000 members, their annual conference, to talk about disease surveillance and how we can benefit from there. Currently, as you would have all seen in the news, there are infectious diseases which in any part of the world can be a risk through anywhere else, including for us in the UK, the ongoing Mpox issue being one real live example. There are confirmed cases in the southern Kerala. We don't have a very good data sharing arrangement, intelligence sharing arrangement, other than within the existing structures of the WHO IHR framework. But having those connections and strong partnerships allow us to share intel in real time. Then the two other focus areas will be on advocacy, particularly for areas where countries in the Indian subcontinent are looking for support is around climate change, climate adaptation, and climate surveillance, where some of the work that's been done in the UK and elsewhere will definitely go in handy. But equally, there is things that we have to learn from other side, in terms of digital technology, use of artificial intelligence, scaling up of vaccine programs, where countries like India have demonstrated significant logistical success of how to deliver those endgames. So it is definitely a two-way street and something that we are very keen to. And of course, the other final point I'll say and then hand over to Hema is that we do want to encourage a number of deserving public health professionals who have contributed to the field of public health over a number of years in those parts of the world to apply for faculties, fellowship and membership exams, which is also, sorry, not exam, memberships, which will help grow the network. And we know that the strength of a professional network will always come in handy in times of both peace and in emergencies. So that's in a nutshell of where we are right now. I'd like to use this opportunity to encourage participants to consider joining India SIG. If you wish to find out any more about it, please feel free to reach out to myself and Hema. We'll be more than happy to talk you through what our plans are, and having you on board would be hugely appreciated. Thank you. I'll hand over to Hema now.
Thank you, Giri. So Giri has given you an overview of where we are. I just wanted to say a little bit, and I hope sort of kind of Chatham House rules apply. So there's been fantastic work done under the leadership of Sushma, but as you know, sometimes there's a hangover of what you had done. So some of the members still want to go back to that, which with the new Global Health Committee's advocacy and the way to work is slightly different from the old, I think, DFID, because it was a specific DFID project. So one thing was about how do we balance the I guess that's the way the previous state used to work with the old memberships, but how do we get new membership to bring in new ideas and work in a different way? So that has been sort of kind of something we've been trying to manage, because it's important to keep both the views, keep everybody in, and it's good that we have now got in July, in August, we've had 7 new members, young members join, who are from not necessarily just from India, but from other parts. So one of the things we said is you don't have to be Indian to join the India SIG. It's more than that. This is about us public health. So it's nice to see that, we've got a few new members and they're not necessarily from the Indian subcontinent. So I think that's quite a good achievement. We are sort of trying to, through informal networks and through the registrars, trying to encourage people to say this is about public health in different countries. So that's something which we've been working on. The other thing which we were looking at is, as Giri said, is to look at which organizations, which bodies, because again, India, like Pakistan, you've got different states, you've got national government, and it's quite complex. And it already has got good, the Institute of Public Health and some good work going. So we have to be very careful in how we approach partners there. We have got good links now with the Institute of Hospitality Management, who are very much into public health. They want to do more in public health. We've had a discussion with them. They are quite happy that we move forward with an MOU. So they're having discussions internally on their board. And once they have come back to us, we will obviously discuss with the Global Health Committee and the system, the people whom we need to discuss with in the faculty to do an MOU. The interesting thing with that particular hospital management institute, it's a very well-known institute, is a majority of their employees, people who have, not employees, people who have come out of the training course there, are managing a lot of hospitals across the Indian subcontinent as well as in other parts of the world. So there is that whole network that they are, and they want to see how public health can support that bit of public healthcare management, etc. So I think there is something that they want from us, but as I said, there's something about we learn about how they train managers, which are now across a lot of countries. So that's something which I think we will progress. The other thing which Sushma mentioned to me, and I've looked into that, is there is the group, the India group in the Parliament, which obviously, although their aim is to look at economic and trade, etc., between India and UK, there is an opportunity for us to work with them to look at how we can join that group and push some of the public health things. But because of the elections here and in India, we had paused that also, although we had a draft letter to send to them. So hopefully, now that everything is settled, both here and there, we can start looking at that bit in terms of how we work with that political aspects, because that's one way you can perhaps start forming some collaborations. The third thing which I think would be useful for us perhaps to discuss, as many of us many have said, is there's a lot of learning to be done from a lot of SIGs, which are in the global health, but the topic SIGs, how do we work with them? Because one of the things which has come, two things which have come up very strongly, talking to partners in India, where there's some strong work going on in terms of tobacco control and tobacco policy. So how do we link with our topic-based SIG to do some work? Because we want to do it collaboratively with them. Similarly with mental health, how do we, there's a lot of interest in mental health. So there's something about us thinking about what are the cross, where there's a topic-based interest, how do we work across SIGs to develop something? So that's something which I'm just throwing in terms of to the faculty, that perhaps we need to do some more cross-linking and working together for some of that stuff. So I'm going to stop there.
So thank you very much indeed, Hema and Giri. And as you can see, there is many complementarities, but each of the SIGs is operating in a slightly different way. And with key priorities depending on the country or the region that they're operating in. Also, that there are members of the SIGs that are based in country, and there is members of the SIGs that are based in the UK. So it's not only from the UK or only from the country. It is really a collaboration and and some harmony. And maybe just a final point before I hand over to Omar is this link across between the topic SIGs and the geographical SIGs is important. We have a number of them, as I already mentioned, within the Global Health Committee, but there are others outside the Global Health Committee, and we have ways that we reach out to the other topic SIGs, but less systematically maybe than those that are embedded within the Global Health Committee. So we need to look if we need to make more links with some of the other topic-based SIGs as to how best we do that. But I'll hand over to Omar Kaya, who is going to talk us through what the thinking is in terms of potential SIG for the Gulf region. So Omar, over to you.
Hello, everyone. My name is Omar Khair. I'm going to talk very quick about the two important topics, the NCDs and the climate change. Can you go for the next slide, please, Carol? This is just a disclosure. Next one. This is the GCC map. As you can see, the GCC consists of 6 countries, Saudi Arabia, Oman, UAE, Qatar, Bahrain, and Kuwait. Go to the... as you know, the NCDs account for 69% to 83% for all that is in GCC. You can see here the highest prevalence of diabetes in Kuwait, which is almost 25%, and followed by Qatar, which is 19.5%, and the highest prevalence of hypertension was seen in Bahrain. It's reached up 39%, followed by Qatar is 38%, and the highest prevalence of obesity we can see in Kuwait, which is 42%. Move to the next slide, please, Carol. So we suggest one of the suggestions is to do training to the medical staff and allied health professionals through knowledge enhancement, like understanding the risk factors, lifestyles, and the should be updated about the latest guidelines, treatment protocols, and the importance of the patient education and engagement. And the second things, I think we should focus about the skill development, like the effective communications technique for counseling the patients, screening and assessment skills like BMI, blood pressure screening for breast cancer, colon cancer, and the implementation of the lifestyle modification programs. Also, the activation of the chronic disease clinics. Can you go to the next one, please? And the second topic we can focus on is the climate. As you see, the top 3 global risks ranked by severity for the short term. The extreme weather event was the second, followed, and the first one was the misinformation, disinformation, and the third one was the societal polarization. And for the long term, the extreme weather event was ranked number 1, followed by the critical change to the Earth systems and biodiversity loss and the ecosystem collapse. Next one, please. This is give you an overview about the climate. It's a hot desert. It's a desert climate. As you see, the rain is less than 100 mil. And in the summer, the average temperature is between 40 to 50 degrees. So the activities outdoors in the summer, it is difficult. You cannot walk, you cannot take a run. And in the winter, the average temperature is between 5 to 15 degrees. And by every decade, the temperature is increased by 0.2 and 0.4 degree. And the number of heat waves is increased in the summer. Next one, please. And as you see, they have the heat impact. They have clinical health risks as heat stress, heat exhaustion, and psychological effects. Also, there is a reduce of human performance capacity and increased accidental risk, and there is a negative impact of population health and negative impact on community economy. Next one, please. The study was done in 1995, shows that Qatar and Bahrain lost 2.3% and 1.9% working hours. This is equivalent to 6,600 and 4,600 full-time jobs. And by 2030, they suggested this number will be doubled in Qatar and Bahrain, reaching up 5.3% and 4.1%. Next one, please. The study was done in 2017, shows that 23% of the construction workers in GCC were at risk at heat stress. And there's also a survey performed among Nepalese migrants workers in Qatar, UAE, and Saudi Arabia, shown that 17.6% of the respondents suffer from heat illness. And in the UAE, the main issue facing the construction workers primarily the heat-related illness, and there is an increased chance for accidents compounded by extended working hours. And for migrant workers in the GCC nation, and challenges related to occupational safety and health, risk as intensified by cultural and linguistic obstacles. I think this is the main two topics we should focus on, and looking for you for discussion.
Thank you very much, Shoma. And I think you've highlighted really critical issues related to the Gulf region. And I mean, there are obviously many other issues as well, but raising those issues, and one of the ways, I mean, that the faculty can work together with you is looking at, you know, policies for awareness, and policies that will actually focus on changing, for example, sale of sugary drinks and these for obesity. And there are several members here that have been involved in working on those policies with government in the UK, and some of them with other governments. So I think that there are ways and means that you can actually work on some of the policy changes that are needed around both obesity and subsequent things such as diabetes and hypertension, and also for climate change. Before I open to the floor, maybe you could just give 1 or 2 minutes on what you have done so far in looking at how you might establish a group for the region.
I just currently contacted two from the faculty members based here in Saudi Arabia, and they are interested to join, and they also agree to in these 2 topics. Also, Victor's supposed to connect us with another member, but I don't know what's the update about this issue. Just for now. Also, we're planning to expand. We're supposed to expand the number of the members to join for the Gulf potential. That's it. I think this is what we've done so far. Yeah.
Okay, thank you very much indeed, Omar. So I'll now open the floor for discussion, and I think that what we would like to focus the discussion on is really how to look at helping the Gulf nascent group with getting members, looking at how to work on their objectives, and rather than, you know, looking at what is, you know, the presentations that we've had from India, Pakistan, and Yemen, which are extremely important and extremely interesting, but they are really the basis to help the Gulf group. So if we could have some comments, suggestions, and thoughts as to how the group can start to work together and move ahead. So Anne, over to you.
It seems that there's quite a lot of synergies there with some of the other SIGs on the obesity side. And so I just wonder, is there any opportunities to make some of the connections there? And there could maybe be some crossover membership, because quite a lot of the issues raised are quite lifestyle issues. So it just struck me that there may well be some crossover there. And I think another way to maybe increase membership is to sort of put out a call on through the SPRs, just to see if anybody would like to join the membership. Just some ideas.
Thanks, Anne. Hema?
Yeah, there are a few faculty members who are working in Dubai. So, for example, I know Kadim Alabadi, and then there are a few others. Maybe it would be good we could put you in touch with them, Omar, so you can have. And you did mention there are a few other. Kadim is quite, you mentioned about all these different health conditions, and I think working at the health authority, he's published quite a lot from the surveys, etc. He's doing quite a lot in terms of policy on that. So maybe it would be a good. We've had discussions previously with him, so it would be good to perhaps have him on your SIG, and I'll put you in touch with him. The other person, as you know, Maida, who is the co-chair of the Sudan SIG, was for 2 years. She was working in Dubai for an American company, and she's got good insights into that. So again, as she would be somebody who could perhaps support you and talk to her.
I think this will be great.
But we would be from the India, and I guess similar to other states, would be quite happy to see how we can support and work together on similar topics that we have across that whole region of obesity, hypertension, etc. So I think maybe that's something which we could have a discussion on.
Thank you very much, Hema, and thanks, Mona. You're disappearing off the call. Kota.
Hi everyone, I'm Kotha Hajat. So I am based in Oxford, but I am very active in the UAE and Saudi and other Gulf countries, and I'm an adjunct professor as well in the UAE. I'm working on several projects and have done since 2008. So it'd be great to meet you, Omar, and anyone else who is working in the region. I have to say, in my almost 20 years working there, I haven't met a single person from the faculty or linked to the faculty. So it's really nice to be able to meet and hear about people in the Gulf, because it feels very isolated, and most of the people working in public health there do not have formal public health training. So it's sometimes a bit of a challenge. So I'm working with Muir Gray on a couple of projects in both Saudi and in the UAE. I work with the UN climate team. So they had the UN climate COP meeting there, and I was actively involved in that on shaping the health agenda. I'm just back from New York Climate Week, talking about how the food we can change the food environment to prevent chronic disease. So there are lots of things happening both on health and climate. We have a WhatsApp group of people working in public health in the UAE. I think I'm the only one from the UK faculty, but I think there are lots of ways to make connections. So I'd be happy to help and be delighted to be involved in that, Omar.
This will
Excellent.
be great.
Thank you, Kota. Thank you, Kota. Susanna?
Yeah, very similar to what people have put in the chat. Obviously, we have a lot of faculty members in the Gulf, including some senior members. I think, if I'm not mistaken, Mohammed Abid was the CPD advisor. So Carolyn will have a lot of the details. So I was just going to suggest that, I don't know, we might want to put together another sort of session just to tease this out instead of putting all the burden on Omar, because there's lots of people, but not many connections. And that's what we're trying to do through these meetings. So maybe a good follow-up system is needed, and I'm happy to support Omar and Carolyn in the ways that are needed, because I think a lot of conversations need to happen. And the thing, just to add, I think they do have their own system of public health training, which is very different from our UK system, and that's kind of what happens in India and other countries as well, I think. So there will be a lot of academics there who are probably not aware of UK Faculty of Public Health, and there's lots of opportunities. Thank you.
It's great. Thanks,
thank you,
Susanna. Gary, Omar, I'm taking all of the comments first, just in the interest of time, but we'll give you a chance to reply.
Yeah.
Gary?
Thanks, Liz. Lovely to hear what Omar was saying about the intention to establish the Gulf SIG. I just wanted to share a couple of things in support of that. One is, I think the academic collaborations are a real strong area to pursue. Well, I put something in the chat with regard to Cardiff Metropolitan University, which is where we take a number of PhD scholars from a number of the GCC countries, and we particularly Qatar, and we have some quite strong links with the ministry there, so we could use those to further strengthen the research agenda. The second is staying in the space of academic collaborations. University of Birmingham run their Masters of Public Health program through their newly established campus in Dubai. And that is also really, I do a bit of work on their health protection module, but there is this wider program there, including the number of things you mentioned around obesity, tobacco, lifestyle related issues. And that offers another good avenue for academic collaboration. And the third thing I wanted to say was, as part of IAMFI, the International Associations of National Public Health Institutes, which is a grouping of about 85, 90 countries across the world, the president of IAMFI is Duncan Selby, who used to be the previous chief executive of Public Health England, and he is also now the senior advisor to the ministry in Saudi Arabia. And he, through both his regular day job links and the IAMFI link, offers another real opportunity for further strengthening of those collaborations. So those are three things I wanted to share. Thanks.
That's excellent suggestions. Thank you very much indeed, Gary. And Kate?
Good afternoon, all. Thank you very much for a really interesting group. So I'm Kate. I'm a nutrition specialist working for UNICEF, based in Amman, Jordan, but working across the Middle East and North Africa. And overweight and obesity prevention in children, particularly school-aged children, is one of my sort of focus areas, particularly on the Gulf. So this is really timely for me. And actually, we're in the process of planning a joint meeting with WHO East Mediterranean Office in February around this, and kind of what Omar discussed, kind of focusing on the policies that you were mentioning. So there's already some of the sugar and sweet beverages taxation work happening across the Gulf, but we're trying to look at that as a really systematic approach. So yeah, just to say, I'd be very interested in sort of linking up, particularly with you and Katha, and the work that you've suggested, and being a member of Middle East SIG. So yeah, thank you. Seems like there's some great work that we can collaborate on.
Excellent. Thank you very much, Kate. Any other hands up before we hand over to Omar for a few reflections? I don't see any hands at the moment. Omar?
I think all the ideas are great, and I think we should, I will connect with all of them I think if we meet one of them alone for in the future to understand how we can go further for progress of our SIG group, it will be wonderful.
Okay, thanks very much. Thanks very much, Omar. I will attempt to summarize. I think that we've had extremely good presentations and very good suggestions on the way forward for the Gulf region. And what it seems is that there is lots going on. There is already many connections between UK institutions and institutions in one or other of the Gulf countries, but there is not necessarily harmonization and linkages across those. We have heard both from Kota and from Kate that you will both be very happy to be part and parcel of this group, both from, you know, within Amman Jordan for UNICEF on Kate and from Oxford Kota. We've also heard from Susanna that you will be happy to help in moving this forward for the Gulf region. And we have a suggestion that Mohammed Abid is working in the region, and also we have some names from, or we have some promises that those of you who've got faculty members who you know in Dubai or otherwise, that you will actually put those in touch with the Omar and the group here. What I would suggest is that in order to move forward, that there is a small group call. So those names that I've sort of read out, plus a couple of others that are going to, you know, we've promised some suggestions, and you've suggested a few members and so on and so forth, that we have a maximum of, you know, 6, 7 or 8 people, because getting out of those maybe 5 or 6 people who will be able to help the work together, or will be able to work together with Omar to tease out a few key objectives for the group. And then once that has been done, I think it's more easy to open up to more members and to call for more people to be members. I mean, I'm also happy to help to work together with the group to steer those, to get the key objectives there, because I think it's clear that there are a couple of priority areas on NCDs. We will also reach out to our NCD team, the NCD SIG, to ask for a member from that group to join in. And I think that with a small core, it'll be possible over the coming, you know, 2 or 3 months to work on objectives, to look at a work plan, to look at setting out a wider call for membership, and have a work plan for 2025. We're already in the beginning of October, so I think it's not too ambitious to look at, see what simple things could be done for 2025, and look at reining in all of the work that is already going on, but which is being done in isolation, and look at trying to make a key network for the Gulf there. There are certainly a number of members of the faculty within the Gulf, but there are certainly a lot of people who would be interested or who already shown their interest, who are based in the UK. So I think that with that, we actually would be able to look at a definitive group being formed, you know, by the end of the year, beginning of the following year. Does that sound a reasonable way forward to you, Omar, and to everybody else on the call?
Yeah.
Yep.
Sounds good.
Okay, well, thank you all very much indeed. We're actually saved 2 or 3 minutes today, which is perfect. You've got time for a break before your next calls. And thank you all very much indeed for participating, particularly for those of you who made presentations and shared your experiences of your SIGs. And I think that this will really help to move forward a special interest group for the faculty in the Gulf region. So thank you all very much and have a good day.